These hydration facts could save your life if you're over 60 and managing type 2 diabetes or blood sugar issues. What I'm about to share isn't just about staying hydrated, it's about understanding how proper water intake can be the difference between stable blood sugar and a medical emergency. Here's a sobering reality. Nearly one-third of Americans over 65 have type 2 diabetes, and another half have prediabetes. That means there's a very good chance you or someone you love is dealing with blood sugar challenges. But here's what most people don't know, and what many doctors don't emphasize enough. Dehydration can spike your blood sugar by 50 to 110 points or higher through osmotic diuresis, essentially turning a manageable condition into a dangerous situation. I'm going to explain exactly how water affects your blood sugar, why seniors are particularly vulnerable, and most importantly, give you a precise plan for using hydration as a powerful tool in managing your type 2 diabetes or prediabetes. We'll also cover the warning signs that could indicate you're heading toward a life-threatening complication that affects 20% of people who experience it. Let's start with understanding why water matters so much for blood sugar control and your HbA1c levels. Your body is roughly 60 to 65% water, and your blood plasma, the liquid part of your blood that carries glucose, is about 90% water. When you become dehydrated, something critical happens. Your blood volume decreases, but the amount of glucose in your bloodstream stays the same. This means your blood becomes more concentrated with sugar, directly impacting your ability to maintain healthy glucose levels below the renal threshold. Think of it like this. If you have a glass of sweet tea and you let some of the water evaporate, the remaining liquid becomes much sweeter because the sugar is now concentrated in less fluid. The same thing happens in your body when you're dehydrated. Amanda Lane, a certified diabetes care and education specialist working with endocrinologists, explains it perfectly. When dehydrated, your blood becomes more concentrated with glucose. But the problem doesn't stop there. When your blood sugar rises due to dehydration, your body tries to get rid of the excess glucose by producing more urine through a process called osmotic diuresis. This creates what we call a vicious cycle. High blood sugar causes increased urination and polydipsia, excessive thirst, and polyuria, excessive urination, which leads to more dehydration, which raises blood sugar even higher. Amy Benny, another certified diabetes educator working with endocrinology teams, notes that when blood sugar is high, the body attempts to get rid of the glucose by producing more urine. This can also create dehydration in the body due to increased urine production. Now, why are seniors particularly vulnerable to this cycle? There are several age-related changes that make older adults more susceptible to dehydration. First, as we age, our thirst sensation becomes blunted. You simply don't feel thirsty as readily as you did when you were younger. Second, kidney function and glomerular filtration rate naturally decline with age, reducing your body's ability to concentrate urine and conserve water effectively. Beyond these physiological changes, there are practical factors that increase dehydration risk in seniors. Memory problems, whether from normal aging or conditions like dementia, can cause people to simply forget to drink water. Reduced mobility might make it harder to get up and get a glass of water when needed. Some seniors also intentionally limit their fluid intake because they're worried about frequent trips to the bathroom, especially at night. For seniors with type 2 diabetes, these risks are compounded. Poorly controlled blood sugar and elevated HbA1c levels create additional fluid loss through frequent urination, making it even easier to become dehydrated. This is why hydration becomes absolutely critical for older adults managing diabetes. Let me share some compelling research that shows just how important adequate hydration is for blood sugar control. The DZER study, data from epidemiological study on insulin resistance, which followed over 3,600 people for 9 years, found that those consuming more than 33.8 fluid ounces, about 1 liter of water daily, had a 28% lower risk of developing high blood sugar compared to those drinking less than 16.9 fluid ounces. Even more striking, people consuming 500 to 1,000 milliliters of water daily had a 32% lower risk of hyperglycemia compared to those drinking less than 500 milliliters. The mechanism behind these benefits involves your kidneys and a hormone called vasopressin. When you're properly hydrated, your kidneys can work at their best to filter out excess glucose from your blood. Water also helps reduce the production of vasopressin, a hormone that stimulates your liver to produce sugar when you're dehydrated. Research shows that increasing water intake can reduce vasopressin levels by up to 41% in just 1 week. So how much water should you be drinking? The general recommendation from the U.S. National Academies of Sciences is about 11.5 cups daily for women and 15.5 cups for men, including water from food and other beverages. For seniors with type 2 diabetes, many endocrinologists suggest aiming for at least 8 cups or 64 ounces of water per day, though some recommend even more, up to 6.5 cups for women and 8.5 cups for men, specifically from water. However, there are important caveats here. If you have heart failure, kidney disease, or certain other conditions, drinking too much water can actually be dangerous. That's why it's crucial to work with your healthcare provider to determine the right amount for your specific situation. In rare cases, overhydration can lead to a condition called hyponatremia, where sodium levels in your blood become dangerously low. Now, let's talk about the most serious complication that can arise from dehydration in diabetic seniors: hyperosmolar hyperglycemic syndrome, or HHS. This is a life-threatening emergency that primarily affects people with type 2 diabetes, especially those over 65. HHS occurs when blood sugar levels become extremely high, often over 600 mmol/dl, combined with severe dehydration. What makes HHS particularly dangerous is that it can develop gradually over days or weeks, and the mortality rate is shockingly high. Between 10 to 20% of cases result in death. That's about 10 times higher than the mortality rate for diabetic ketoacidosis, the other major diabetic emergency. Due to the massive fluid loss, patients with HHS can have up to 9 liters of water deficit in their body. The typical scenario involves a senior with type 2 diabetes who develops an infection. Pneumonia, urinary tract infection, or sepsis are the most common triggers, accounting for 50 to 60% of HHS cases. The infection raises blood sugar, which increases urination and fluid loss. If the person isn't drinking enough water to compensate, perhaps because they feel unwell or have diminished thirst sensation, their blood sugar continues to climb while they become increasingly dehydrated. Warning signs of HHS include extreme thirst, polydipsia, frequent urination, polyuria, nausea, vomiting, confusion, drowsiness, and eventually loss of consciousness. However, here's a critical point for seniors and their families. Traditional signs of dehydration like skin turgor, dry mouth, and even thirst sensation are not reliable indicators in older adults. Research shows these signs lack sufficient sensitivity and reliability in the elderly population. Instead, pay attention to darker urine color. The darker your urine, the more dehydrated you are. Fatigue, confusion, and dizziness are also important early warning signs. If you notice any combination of these symptoms, along with high blood sugar readings or elevated HbA1c levels, seek medical attention immediately. Let me give you some practical strategies for maintaining proper hydration as a senior with type 2 diabetes. First, timing matters. Make drinking water one of the first things you do each morning and have a glass before each meal. This simple habit can help you consume a significant portion of your daily water needs without having to think about it constantly. Amy Benny suggests building the habit by pairing water consumption with other activities, after you brush your teeth or when you take medications like metformin. This creates what behavioral scientists call habit stacking, where you attach a new habit to an existing routine. Keep water visible and accessible. Put a water bottle in your car, next to your chair where you watch TV, or on your kitchen counter. As Benny notes, if it's in your visual field, you may be more tempted to drink. For seniors with memory issues, set hourly reminders on your phone or use a pill organizer-style water tracking system. If plain water seems boring, there are ways to make it more appealing without adding sugar or calories. Try adding fresh berries, cucumber slices, or a squeeze of lemon or lime. Sparkling water is another excellent option, as long as it doesn't contain added sugars. Caffeine-free herbal teas and small amounts of skim milk can also contribute to your fluid intake. However, be careful about what you're drinking. Sweet beverages like juice, regular soda, and sports drinks can hydrate you, but will also spike your blood sugar significantly. Energy drinks are particularly problematic, as they often contain both high amounts of sugar and caffeine, which can worsen dehydration. Remember that about 20% of your fluid intake comes from food. Water-rich fruits like melons and berries, soups and stews all contribute to your hydration status. This can be especially helpful for seniors who struggle to drink enough plain water. There are some special considerations for seniors taking diabetes medications. SGLT2 inhibitors like canagliflozin, dapagliflozin, and empagliflozin work by causing your kidneys to remove excess glucose through urine, but this also increases fluid loss. Unlike traditional medications like metformin, which works through insulin sensitivity, These newer drugs can significantly increase your dehydration risk. If you're taking SGLT2 inhibitors, you may need to drink even more water than the standard recommendations. On the timing front, while it's important to stay hydrated throughout the day, be mindful about drinking large amounts of water right before bedtime. Excessive fluid intake can lead to nocturia, frequent urination at night, which can disrupt sleep and increase fall risk when you're getting up in the dark. If you're using a continuous glucose monitor, here's something important to know. Dehydration can actually affect your readings. CGMs measure glucose in your interstitial fluid, and if you're dehydrated, you may get falsely low readings because there's less fluid available for the sensor to read. Let me address a common question. Does drinking water directly lower blood sugar? The answer is somewhat nuanced. Water itself doesn't lower blood sugar the way insulin or diabetes medications do. However, proper hydration helps your kidneys function optimally to filter excess glucose, and it prevents the concentration effect that occurs when you're dehydrated. So while water won't treat high blood sugar like insulin resistance medications, it certainly helps prevent dehydration-induced blood sugar spikes. Some research has shown mixed results about drinking water with meals. One study found that adding water to meals actually increased blood sugar response in both healthy individuals and people with well-controlled type 2 diabetes. However, the research in this area is limited, and the overall benefits of proper hydration far outweigh any potential meal timing effects. For family members and caregivers of seniors with type 2 diabetes, watch for subtle signs that your loved one might not be drinking enough. These include decreased energy, confusion, dark urine, and complaints of dizziness when standing up. Social isolation is actually a precipitating factor in 1/3 to 1/2 of hyperosmolar diabetes episodes in the elderly, so regular check-ins are important. The 2025 American Diabetes Association Standards of Care, Section 13.2, specifically highlight that older adults with diabetes may be subject to acute complications, including dehydration and hyperglycemic crises. The guidelines emphasize keeping blood glucose levels below the renal threshold to prevent hyperglycemia-mediated dehydration, essentially preventing the vicious cycle we discussed earlier. Here's what I want you to remember most. Adequate hydration isn't just about comfort or general health when you have type 2 diabetes. It's a critical component of blood sugar management and maintaining healthy HbA1c levels. The difference between being well hydrated and mildly dehydrated could be the difference between a normal day and a medical emergency. Start today with simple steps. Put a glass of water by your bedside tonight so it's the first thing you see in the morning. Set a phone reminder to drink water every 2 hours. Keep track of your urine color as a simple hydration indicator. And most importantly, if you notice any combination of increased thirst, polydipsia, frequent urination, polyuria, confusion, or fatigue, along with high blood sugar readings, don't wait. Seek medical attention immediately. Your health as a senior with type 2 diabetes depends on many factors, but proper hydration is one of the most controllable and impactful. Make water your ally in managing your blood sugar, and your body will thank you for it.